Thank you very much to all of you, and we are back right here. We hope you enjoyed the startup demo. Remember that you can visit their booth and contact them through the app to get more information. Did you download it? I hope so. It's fantastic because if you missed a demo you really wanted to see, the videos from the show and tell are all available on the app in the video section. Now it's time to start with the investment panel. I would like to introduce Tim Smith, Iberian consultant at Sifted, who will moderate this panel on the state of digital health investment with key insights for those of you looking at raising money. Right after that, we will follow with the eHealth Investment Forum. So, Tim, the floor is yours. Thank you.
Thank you very much. Hello everyone and welcome to this panel on the state of investment in digital health. Thanks to Barcelona Health Hub and all of you online for being present with us today. And of course it's a really topical time to be talking about the state of digital health investment, the conversations around investor confidence and behaviour in this sector in the middle of a global pandemic. Numbers in terms of investment have surpassed, as of Q3, what they were in 2019, and it looks like it's going to be a record year. So over the next 45 minutes or so, we're going to be discussing where the money's going and what the decisions behind the investments are at the moment, and how things might be likely to change as we all adapt to new rules of the new normal at the moment. And we've got some great investors and panelists today, so I'm going to get straight to it and introduce who we've got here with us. We've got Miguel Valls in the room with me from Alta Life Sciences. Alta Life Sciences is a life sciences, biotech, digital health focused fund based in Spain and the west coast of America. He's with me here in Barcelona. We've also got Rocio Pilado in Madrid. She's from Adara Ventures, a VC firm focusing on deep tech, including solutions like artificial intelligence applied to health issues, which we'll hear more about later on. And speaking to us from London, we've got Sophie Ehrlich from Silicon Valley Bank. Silicon Valley Bank helps innovative companies to grow, and Sophie, the VP of Digital Health and Life Sciences there. In Amsterdam, we've got Lara Kuhl from Philips Ventures, who's bringing some very valuable corporate venture experience to our panel today. And in Baltimore, we have got Logan Plaster from Startup Health, which is not only an investor, but a content provider and data gatherer on this ecosystem. So thanks very much to everyone for being here today. And I'm going to start with you, Sophie, because Silicon Valley Bank also gathered data, published midterm reports about the sector. Could you just give us a kind of overview of what you've seen in your midterm report about what we know about where the investment in digital health has been going since the start of the pandemic?
Sure, and really happy to. We published a report just 2 months ago showing the first half of this year. And in the last 2 months, so much has happened in this sector and so many investments have been made that it's almost outdated in many ways. But I would like to share with you just high level what we're seeing. So as Tim mentioned, so far this year, in the first 3 quarters of this year, the amount raised by companies, which is VC money raised in the US and Europe, has exceeded the entire 2019 year. So just to give you some numbers, in 2020 so far, in the first 3 quarters, $11.2 billion has been raised by companies with VC funding. And in 2019, last year, it was 10.5 for the full year. Now, what's interesting and what we can all, see from the news and from all the press releases is that this year so far, from Q1, Q2, and Q3, it's steadily increasing every quarter. The amount of money that is raised by US and European companies is going up, and it's going up to the right. So just to give you an example, in the first half of the year, 6.4 billion was raised in the US and Europe, and just in Q3 alone, 4.8 billion was raised. So the question is, and Tim mentioned it before, what's going to happen in Q4? How are we going to end this year? Is it going to continue with this trend going up to the right? It seems like it probably will, because there is a lot of money and a lot of focus going into this sector. and quite rightly so. Now, if we look at, the money's going into the sector, but it's not going into every area. So where are the VC dollars actually going into? They're actually going into three main areas. One of them is, and the main one is alternative care. So 40% of all the VC dollars are going into alternative care, which basically means any telemedicine, remote monitoring, any primary or specialty care outside of the hospital or the clinic. So 40% is going into this space. The next main area is provider operations, which is how can we use technology and which companies are developing solutions to make hospitals and clinics much more efficient, and wasteful spending can decrease. So examples of this are apps for doctors to schedule appointments, anything to make hospital and clinic work much more efficient. And the third area where we see a lot of the money going into is digitizing clinical trials. So any solutions to accelerate the drug discovery and this process and to make it much faster and much less expensive. So these are kind of the main areas that we're seeing funding go into.
Brilliant. Thanks for giving us a quick rundown. And as you said, that's kind of focusing on European and US companies, but we're lucky enough to have Logan Plaster here, who can give us a little bit of a rundown about what's happening in Asia in this space, and particularly China, who have obviously become big players in digital health. So Logan, can you just kind of follow up from what Sophie said and just tell us what you're seeing from your data?
Yeah, thank you for having me. It's a pleasure to be here and an honor to follow up, Sophie. Something that's been important to us at Startup Health as we've been creating our insights reports over the last 7 years is to identify hubs of innovation around the world. And so we do that for the United States, and we do that for outside the United States. And for the last few years, cities in China have really dominated that list of most funded cities outside the United States. And notably, it's not just Beijing, it's Guangzhou, it's Hangzhou, it's Shanghai, it's Shenzhen, often making that top 10 most funded list, even topping, international hubs like Toronto, Berlin, and others. So that's a trend we've seen over the last 3 years. It was notable when in 2020, as we were making these lists, we saw China drop off of this most funded list almost entirely for the first 3 quarters of the year, replaced by cities in Europe, cities in Israel. But then interestingly, as we put out our Q3 report,
Oh, we seem to have momentarily lost Logan.
Oh, I'm sorry. Am I back?
But you were saying about your Q3 report.
Yes. What I was saying was that it was interesting to see that in lockstep with COVID, these cities in China that had been making our top 10 most funded cities list for years all dropped off, as to be expected. But then in our Q3 report, Beijing is back on top, having raised $861 million for the year. Now that's down considerably from 2019, down even more from 2018. It's closer to 2017 or even 2016 levels for Beijing, but still interesting to see them back in our top 10 list. Mumbai, Singapore, Delhi also making our top 10 list in 2019, but then falling off in 2020. So I think both of those interesting trends to see. Not shocking that not shocking to see that in China that investment is consolidated in a few deals, where a city like London is seeing a similar amount of funding, but across 10 times as many deals. So there's more activity in some of these cities in Europe, but in China, the activity really centered around a few really mega deals. We have players like Tencent with WeChat. We have players like Ping An with Good Doctor that are, where funds are consolidated. So interesting to see that movement back into China and kind of to see how players like Tencent and Ping An are responding to COVID with what was it? Yeah, with Ping An, with Good Doctor, their telemedicine platform saw a 900% increase in activity due to COVID. I mean, that's not shocking if you look at telemedicine numbers across the U.S., et cetera, but still those investments really paying off in terms of increasing the channels between Chinese citizens and their doctors. So interesting to see that picking up the way it is in China.
And I think that your answer and Sophie's gives us a great picture of what's going on. And what's clear is not only that there is increased and continuing interest in digital health, but that seems to be slightly more focused on Europe and the US than China in the first part of this year. So I'm going to come to you, Miguel, now. As someone who's kind of invested in health tech, biotech, solutions like these for a very long time, do you think increased interest in this sector has the potential to create more competition from you competition for you as other investors look to this space who weren't previously there?
Mm-hmm. Well, first, thank you so much for inviting me, and thank you to Barcelona Health Hub and Barcelona for being resilient in these extraordinary times that we are all trying to fight this pandemic. I think that COVID has been a game changer, right? In terms of the acceleration of the trends that we already had. But really we are seeing an exponential transformation in the speed of adoption that we are seeing, created basically by need, because there is no other thing than need when you really paralyze society, right? So in terms of competition, I like to see it a lot more like co-opetition, right? Because I think that we all need to really work together to develop these new technologies. I mean, in a panel before, they were saying that Spain has responded very well to the pandemic because we had really good networks, right? Once everybody goes online and you don't have the possibility to really move, but you need to take care of the care, I mean, the bandwidth and the network are very important. So for us, that means that really we are operating in this market. Of course, we have competitors, but we are really all cooperating to really try to move forward in these times.
Yeah. And let me put the same question to Rocio, because you guys are a fund focused on deep tech traditionally, not necessarily health tech. But are you finding that you're seeing more deal flow coming through in health tech, and how are you viewing those opportunities differently? And also, we've heard about how remote solutions particularly have grabbed a lot of the money so far. What's your view of what will be a short-term change in investment patterns, and what are kind of more structural changes that might continue after social distancing and quarantining comes to an end?
Perfect. Thank you for having me here, Tim. So the first question, as you said, we're not traditionally investors in digital health or health tech. We've started investing on digital health just a few months ago. Actually, we started looking at opportunities in the space a year ago. So we're pretty new on this. What we did so far is to invest. I mean, we are investors in tech, and we've seen in these recent years, how GPUs, data storage, other IT infrastructure, all that is been getting cheaper, more accessible, and that gave the health industry really the opportunity to start using some of the technologies that we're already using it. I mean, in place in other industries, in other sectors, and now we see that hospitals, pharmas, they are starting to start using these technologies in a very innovative way. And that's why we have started looking at the space, basically. And talking about telemedicine and stuff like that, we only do investments in B2B companies. So we don't do anything about, any investments related to telemedicine or remote medicine. But it is true that with this pandemic, what we've seen so far is that before we tended to invest or to lead investments by ourselves. And in the past months, investors are more willing to share deal flow and to collaborate into creating strong syndicates to really give the opportunity to these technologies to get to market, mostly in health. And actually, the last two investments we did in health, we did it with other investors in the space, and I think that's one of the main things, the main good things coming up from the COVID, at least for investments, right? So people are more willing to syndicate, and that's better for the company. So we don't need to fight over the deals. We can all help the same companies and do our bets on that sense. And talking about the sectors, just a little. So as I said, we don't invest in remote medicine or telemedicine. But we did one of the investments in enhancing the clinical trials process. As you said, as you guys said before, that was one of the trends. And then we also did one enhancing operations and processes within a hospital in radiology. Really something that COVID is also pushing. Definitely, to get more effective and most cost-effective in medicine in the hospitals, yes.
Yeah, and you've both spoken about how this current situation we're in has really sped up adoption of digital health solutions. Lara, let me come to you in Amsterdam. What are you seeing in terms of not just the hospitals and the doctors themselves, but how are governments and health ministries engaging with technological adoption now? I know that Germany has certainly changed its tune on kind of how it's approached digital health innovation.
Yeah, absolutely, and thank you, and thanks for having me here. I think what we're seeing, and as a corporate, we obviously also, as a large health technology player, have kind of a unique position as we are in a digital transformation as a company ourselves, and also a digital health investor. So we're able to kind of look at it from the larger corporate strategic perspective, as well as working together with startups to help accelerate digital health and bringing digital technologies to healthcare. And what we've specifically saw in also throughout our investment portfolio is that it's still, even though there is an acceleration, there's still a multi-paced development. So in some countries, you've seen a significant acceleration of the regulatory environment enabling digital health reimbursement, for instance, and you mentioned Germany, which I think is a great example there. And also other countries have shown that while before the payers and the regulatory environment took years and years to slowly adopt new regulation and slowly create a window for digital health opportunities to enter through, essentially, and to scale. That suddenly became the speed increased significantly, and due to COVID, suddenly the need became so high to have these remote solutions that the regulatory environment suddenly, within days even, we saw changes. And in Germany, it seems to be structural now, because I think the key question that everybody was left with, including many of our portfolio companies, is that's great that you're now creating this environment for us and these emergency actions, but will it be structural? So can I really now enter the German market, access reimbursement, and be a structurally adopted solution on that market? And we're seeing similar movement in the Netherlands and also in France and UK. But the question still remains, will that be a structural push from the regulators and the reimbursement system, or is it a temporary window that then will be closed and you get back into the slog of driving those those very important stakeholders in healthcare forward and making this structural.
And Miguel, what do you think about that question in Spain in terms of government and public cooperation with innovative solutions in health?
Well, I think Spain still is behind. I think that we really have a big improvement in front of us, and I think specifically there's something that is very important, and especially right now in the COVID moments, right, which is that there are technologies that really can help. But sometimes they're not even really understood yet, right? What they can do by the physicians and advisors there to the government, right? So I think it's important to really pay deep attention to what these technologies can do in the short term. And I agree 100% with Lara that we still have a bureaucratic machine which needs to really help to really move forward, because it's just a real need right now. I mean, we don't know how long it's going to last, and the only thing that we really know is the effects that it's creating right now. So that's a big call to all the governments to really move forward and take it seriously.
Sure. And Sophie, let me come back to you in London. I just wanted to ask, as someone who helps innovative companies to get investment, what have you seen in terms of the way that the push to remote work and being online and working from home has done to geographical boundaries around investing? Has it made it easier to strike up a relationship with a long-term investor as you see it?
Sure. And I think that, we've all become virtual. Healthcare's become virtual, but we've all, changed our behavior. And we're all virtual. Instead of sitting together in Barcelona today, we're all on different, blocks on the screen. And I think that in terms of investment, if I look at, I head up a portfolio of companies in the EMEA region. And if I look at the portfolio of these digital health companies, most of them have raised within the last 2 or 3 quarters. And they've managed to raise, and they've managed, some of them have had oversubscribed rounds, which is very, very positive. But I think that a lot of these investments have been made with investors that they already knew before COVID. So they'd already met them in person and had, several conversations, and maybe a little bit of due diligence was done prior to March. I think it'll be interesting to see, long term. I think we're all going to be remote for quite some time. So it'll be interesting to see how, these deals are done, 100% remotely. Because it is important with a company to get to know them, spend time with the founders, spend time to meet the team. And it can be done virtually, but it's just not the same.
Maybe I'd like to put that question to all the investors here. So I'll start with Rocio about how important is it to you to get to know someone face to face, and how are you approaching those kind of relationships with new founders in this remote paradigm?
Yeah, I mostly agree with Sophie. For us, it's really important the personal relationship, the feeling, the talking with entrepreneurs. It is true that we did close a deal during the pandemic without a physical interaction or personal interaction with the founders and the team. But it was one where one of the team members had met the entrepreneur 3 or 4 years ago. It felt, I don't know, less strange. But it's the only company we closed really without knowing or meeting the founder. And I really believe it's important to get that personal interaction in our space, at least as investors. It's true that most of our work can be done remotely, and thanks to the pandemic or because of it, we will be doing most of our work in remote. But I don't think that's going to last forever. I don't think it's sustainable, at least as an investor.
Miguel, would you agree that, really ideally you want to have a face-to-face with a founder before backing them?
Well, I think that's the big key question. I'm not sure. what we have done in Alta has been, we have done 3 new investments during the pandemic, but the reality is that we had met the companies before. We did some follow-ons also, and we are looking at many companies right now 100% remotely. We have not closed any deal so far, but we're getting very close to see if we need to take a decision. So I cannot answer that question. But one good news is that, I don't know if you have seen it, but a big private equity firm, I don't recall the name right now, just closed a $6 billion fund 100% remotely, right? Mm-hmm. So I think that we're starting to see this change, and I know it's awkward and difficult because for us, number one thing on our investment is the team. There are many other things, right? But team is very important. So not meeting the team directly is something that I've never done before. So I really cannot answer. But we're working forward. So we'll see very soon.
Yeah, well, it's early days, isn't it? And I suppose we all hope that there will be a return to face-to-face interactions before long. And another question, just from the investors themselves. I'll come to you this time, Lara. How much time is going into helping portfolio companies as opposed to searching for new deals? Because obviously in a time of crisis there is management of your own portfolio and your own interests to look after, as well as looking for exciting opportunities. So how are you balancing that? And then I'll ask you guys as well afterwards.
Yeah, absolutely. So absolutely, a lot of attention, and especially really at the onset of the pandemic and in the beginning went to our current portfolio. And we saw, as we have a solely digital health portfolio, really active in all of these spaces that we've earlier discussed, that's attracting so much funding, that really we saw 2 different things happening. One, for some, there was a kind of a crazy uptake in demand. They had to suddenly pivot their product to help COVID patients essentially deal with a massive uptake of usage and engagement, versus where some others that were actually kind of in the implementation stage at providers that were all suddenly froze down and got locked down immediately due to the fact that these providers were just not able to focus anymore on implementing new solutions and thinking about innovations while their ICUs were filling up with COVID patients. So it was really 2 different paces. So it took a lot of attention to understand, okay, what does it mean for you? What does it mean for you? What is your new budget going to look like? What do we need to stabilize? Do we need to fund small bridges to ensure we get through this stage of extreme uncertainty, essentially, and figure out what's next, well, afterwards, if there's going to be an afterwards at some point. I think if you look at that initial period, probably 90% of our attention went to current portfolio, except for deals that were already in process, because we did close 4 investments in the first half of this year. I do think that only over the summer, we started again to really continue developing the pipeline, and we had any bandwidth in our 5-person team here in Europe and the US to consider new investments and building new pipeline again. So I think the balance now is getting back more to pre-COVID stage. But yeah, definitely there was a crisis management period in there in the beginning.
Sure, is that something you'd concur with, Miguel, trying to balance those?
Yeah, I mean, for us, it was somehow binary, right? Let's say on the screen diagnostic on telehealth, and then on the virtual care, primary or specialized. I think that there's been a big acceleration, extremely important acceleration, where you have been really helping the companies a lot, and you continue because it's a big trend. On the other side, and here it goes more on the biotech space maybe, and tangentially by the clinical trial side. I mean, we are seeing some difficulties, because clinical trials are not easy right now, right? So the technological part or the efficiency on clinical trials and technology applied to that, I think is very important, but it's kind of a balance in terms of...
Yeah. And Logan, that brings me on to my next question, which is that, as we've just heard, for certain areas of digital health and health innovation, they might be suffering as a result of the flood of money into these particular sectors around remote health, telehealth. What do you think are the possible opportunity costs, perhaps, of the very directed and crisis-led surge of investment into those two areas?
Yeah, I think the risks there are pretty obvious. Startup Health, we cluster our investments into what we call health moonshots. These big, audacious goals that we encourage companies to collaborate around, things like access to care, lowering cost, and then children's health, women's health, the opioid crisis, pandemic response, and definitely anything that wasn't this kind of alternative approach to access to care dropped off. We have a number of companies in our portfolio who work on sort of niche areas of women's health. They struggled for the first 3 quarters, but I'm seeing them come roaring back, and interest in these other areas coming back. I think there's some interesting, ways in which these worlds are coming together, where there was a sort of phase 1 where we said, okay, we need virtual care and telemedicine yesterday. And so there was this massive adoption and investment interest. And then, pretty quickly, starting to see how those methods apply to these other niche areas. So investment growing in the end cancer moonshot, even though that's not directly telemedicine. Same with women's health, same with mental health. I'm seeing some interest in how those niche areas interact with the telemedicine that everyone is so hyped about. So, I'm optimistic to see that while there was opportunity cost over the first 3 quarters of 2020, that there's already, spillover benefit in these other areas.
Let's use that as an opportunity to not just look at what this crisis has done to date, but what it might be doing to investment in the future. And Logan, you mentioned your moonshot areas, and you also mentioned specific niche health options. What do you think about how digital investment is going to start going towards perhaps communities who haven't had the healthcare that other communities have had, minority groups?
Yeah, what really excites me is the way that telemedicine isn't just opening up access to care for, let's say, a rural patient who wants to go to the primary care doctor, which is kind of a one-to-one replacement, but telemedicine and AI chatbots and these other methods of remote care are opening up care for areas of health that were stigmatized and culturally underutilized. So I'm seeing a surge in women's health startups around sort of taboo areas of bladder health or below the belt health. Companies like Privy and Renalis come to mind, but areas where women weren't seeking the help that they needed for cultural reasons, and telemedicine, AI actually opening up access to care where it wasn't being received before. Same goes for mental health services, for communities. A couple of startups that I just thought, just was reading about recently, trying to reach Black men, a community that has traditionally been underserved by mental health. So not just using telemedicine to extend the doctor's visit to a patient who would have come in anyway, but actually using telemedicine and AI and virtual care to reach completely unreached communities and expand access in exciting new ways.
Great. And Sophie in London, what do you think? I mean, what if you had been making predictions at the start of this year, what would you have said were likely growth areas, and how do you think that's been affected by the pandemic, and what would you say are likely growth areas beyond telemedicine now?
Sure. So I agree with Logan with the taboo areas. We're all at home and we're all remote. So there's privacy, anonymity, and we can get different devices delivered, in discrete packages home and take care of different, health aspects. So that's definitely, one thing. I think digital mental health was one that initially it was remote, telemedicine, but the mental health access, with the social isolation, with the pandemic, taking time and going through all these different waves and phases, the digital mental health is a huge area. And it's an area which, it's a global area that really needs, a lot more focus. And there are some fantastic companies that are focusing and giving solutions here for it. It's also for the younger population, so especially for adolescents, kids that aren't hanging out with their friends right now, aren't having a proper university experience. This is a really huge area which, telehealth and teletherapy can certainly really support. In terms of areas, I think just going back to my last point on how we've all changed our behavior and how we're all virtual and on screens a lot of the day. Behavioral health a couple of years ago was an area that I struggled with when looking at companies because it was so difficult for people to change their behavior or for apps to enable people to change their behavior, whether it's, to reduce diabetes or to stop people from smoking. And actually now looking at the world, we have all of us are changing our behavior all the time, and we've drastically changed the way we live, the way we eat, how we focus on our healthcare, how we interact, how we work. And so I actually think that this is a really exciting area for behavioral change in general, given that health is front of mind, health and well-being is front of mind for everyone right now. It's a top priority area. We all want to be healthy. We all want to stay safe. And we all want to make sure that we can, live through, different days, not our usual kind of 9 to 5. So I think the behavioral health and the mental health are kind of areas that I'm really excited about. And I think lastly, every kind of time of war or crisis, there's always incredible innovation that comes out of these phases. So I'm really psyched about the next wave of digital health. So the next batch of companies and technologies that are going to come out of this space, especially in Europe, and it'll be great to see what comes out of Barcelona. So I'm keeping an eye out to see what great company tech comes out of your part of the world.
Very much. And Miguel, I'll come to you. What are you seeing here and elsewhere in your portfolio in terms of future trends?
Well, I would like to start with something a little bit different. So I read on the Financial Times a very interesting article about how you prevent the pandemic. It was very surprising that Africa, it's the continent that having such few resources, especially ICU beds, right, which they have very, very few, how the impact of COVID it's so different from other more Western or developed areas, right? And prevention was extremely important in the collaboration of 54 countries in Africa when we were on the first wave. So that shows you how these markets are adopting things that are extremely important right now, because digital health is important, but the prevention is extremely important. So how you apply these new technologies over that, I'm very optimistic, right, in these countries, because I think that they are going to be leapfrogging. And if you really have this mentality, I think the adoption is going to be good. In terms of behavioral finance, I think that we're going through a very important transformation. Our thesis at Alta is that we do really life science plus deep tech, which it's a very interesting dynamic because it creates very, very interesting opportunities. Specifically on behavioral finance, I think that VR plus AI, it's going to make a huge difference. We're seeing very promising companies doing many things to really solve these huge problems right now that we had with behavior. And also, I think that we need to be very aware, all of us, that when this pandemic ends, there are going to be many collateral damages for how we have managed the whole thing, right? So we will need to give a lot of care, and help a lot, because there are going to be difficulties, not just, for the economy, but also for the behaviors that we have been going through, etc.
Brilliant. And I'm just going to come to each of you now. There'll be a lot of founders of health tech companies watching who might be seeking investment. Could you just give me a quick, set of tips, or one main tip that you would give to a founder looking for investment at the moment? Lara, I'll come to you first.
Yeah, sure. Well, obviously, I'm a corporate venture investor, so for us, it's always important to see how a solution or a digital health company and what they provide would at some point align with the vision of where Philips wants to be at a certain point in time, and also has a concept of where the potential portfolio fits would be with a company like Philips. So it's always good to kind of have a look at what's the strategic direction that Philips is aiming for, and I think important elements there are also where we traditionally were very much a provider-focused or direct-to-consumer company. We're looking into many ways in how you actually can bring care into other settings than into the hospital, and also help hospitals in all this massive amount of data that is now coming off all of these remote patient monitoring type propositions, and we're ourselves also very active in remote patient monitoring, and actually make that actionable for the health system to ensure that patients or people don't even have to come into the hospital anymore, or are kept out of the hospital after they've been treated. So I think solutions that play into that play into making the data we gather, making the remote patient monitoring type proposition actionable. That's really topics that we are looking for. And further, it's early stage. So if you're in that early commercial stage and feel like you're onto something, but could really use the strategic expertise of a medtech company that has a global footprint, then definitely come and reach out.
And same question to you, Rocio. One tip or a couple of tips for founders.
I would say that I think this is a tip that works in pandemic or not, but now is especially important. I would say that try to get warm interest to the VC firms that they think they have the most fit with you. And the warm interest in this case, with the pandemic, as we said, we're working from home most of the time. The personal interactions are very limited. So warm interests are more important than ever to get, the confidence and build the trust with the entrepreneur in order to invest. So I could say that at this point, this is one of the main tips.
Sophie, I'm going to come to you with the same question. And what would you say to an early stage founder as they kind of start their journey as a health tech startup right now?
Sure. So I think fundraising is more than a full-time job. So if you've got a small team, and if you're a CEO and you're fundraising, try and get the support of a strategic CFO, even part-time. Otherwise, you may not, reach the commercialization goals that you'd like to, just because the fundraising takes so much time, capacity. And I think the second one would be fundraise when you've got cash, when you've got a decent runway. Don't fundraise when you're running out of cash, because you're not in a strong position to do it, and it takes time. So try and raise when you've got several months of runway, as long as possible would be.
Great. And same to you, Miguel. A tip.
Well, for us, before or after pandemic, it's the same, right? The first team, strong team, then patent and regulatory strategy, business model and relationships, scalability. What we think it's important is on the combination of life science and deep tech. You have the interaction of different flows and trends, right? That you need to really grab in order to evolve as a company. So that's very clear for us.
And Logan, I'm going to come to you. We're just in our final minute, but as someone who collates data and stories around what's going on in health tech, just give us your kind of upsum of where this discussion has left us and where we are in terms of the state of investment in digital health.
Thanks, Tim. Well, obviously, we've taken a big hit. I think it was very apt when Miguel talked about sort of the binary nature of the year. Companies that took a huge hit and other companies that saw 1,000-fold growth. And then we talked about how that's actually going to come together and really lay the groundwork for an exciting next phase of innovation. I really agreed with the sentiment that out of these hard times come really exciting waves of innovation. So the funding seems to be catching up in terms of our insights reports. We're up on track for a record 2020, and companies seem to be responding in kind. So, not to be overly rosy, but it leaves me very optimistic for the future, and leaves me very excited to see what health innovators come out with end of 2020 into 2021. Particularly out of Barcelona.
So thanks to all our panelists, to Miguel, to Logan, to Lara, to Sophie and to Rocio. And thanks again to Barcelona Health Hub for hosting and organising such a great set of guests. So thanks very much, and I'll hand back.
Thank you very much to all of you guys. It was a very, very interesting panel.